Well, it's time to imagine better health with CHI Health.
Here, I'm
Sleep.
motioning.
I know. Well, we've got these things. We've got all kinds of tools and face masks. And
People are going to recognize Kathy. Thank you, Kathy.
thanks, Kathy, for bringing
this. This is what I was asking
but
for.
But really, sleep apnea, it can be dangerous if it goes untreated.
That's right, and that's because if you're not breathing, the stop and the start, it happens repeatedly, even dozens of times a minute. Getting to a diagnosis and eventually what we're holding on to here, it all starts with a sleep study.
It does. And Dr. Harvey Hopkins is a CHI Health pulmonologist. Good to see you, doctor.
Hi, it's nice to meet you.
You brought some show and tell items in, and some people out there will recognize this stuff. But first, let's talk about sleep apnea. How common is it?
In the population of over age 35, probably about 4% of men and 2% of women in population. But in population studies where you actually just look for it, watching them breathe at night, it can be up to 24% of men and 9% of women.
Wow.
And some patients, we'll talk about like that feeling like they're choking, they're running out of air. Physically, what's going on that causes that?
Sure. Actually, most people don't have that complaint. The most
Really?
common complaint is waking up in the morning feeling tired, not unrestored sleep, or falling asleep easily during the day, or their bed partners complaining about their snoring and quitting breathing at night is a very common complaint as well. But most people are very unaware that this is happening to them at night. They can be waking up, 30, 60 times an hour without even knowing it. My personal record of seeing a patient was 170 times an hour.
Oh, you're kidding.
Yep, and they don't even know that this is occurring.
Didn't know, they were just tired, or
Right.
how
Yes.
did they
So
know
how are they
it
going
was
to get any sleep when they're
Right.
waking up? Yeah,
Exactly.
Crazy. And I've got a friend who's got sleep apnea that said the same thing. Woke up just feeling exhausted every morning. Went and got a sleep study, and they determined he had sleep apnea. But what are the risk factors
For sleep apnea? In adults, the biggest risk factor is, and why it's so common in this country, we're all over almost all of us are over our ideal body weight. And so as our neck gets thicker, it gets narrower. And that starting at about age 35, you start losing muscle tone in your body. So from where your uvula sits in the back of your throat to right about here, your whole throat's held open by muscle tension. There's no bones or cartilage. And so as it gets narrower by a little excess weight, and also from loss of muscle tone, things get floppy. Those aren't the only risk factors. Another common group of people I see are very slender people with sleep apnea because they have a receding chin, and their facial structure is such that their airway's narrowed.
And they're more susceptible just because it's the way they were born.
Right. And in children, it's very common in children too. About 1% of children have it, and it's due to big tonsils and adenoids typically.
Wow. And I'm thinking about kids and how their schoolwork's affected if they're not getting good quality sleep. And I mean, we know how important sleep is. We hear about it all the time, and some people might not realize how poor a quality sleep they're getting. Let's talk about the different grades of sleep apnea, right? It can be moderate, it can be severe. What are the signals for either of those categories?
Well, the symptoms don't actually correlate very well with the degree of severity, but we kind of break it down into 3 different degrees of severity based on how many times you quit breathing an hour. Mild is 5 to 15 events per hour. And what it is as you're going to sleep and falling asleep, your throat closes off. You can't breathe, or it becomes narrow and it's hard to breathe, so you wake up. And so you're waking up 5 to 15 events per hour. Moderate is 15 to 30. Severe is greater than 30.
Can sleep apnea lead to other conditions, though?
There's an increased risk of strokes, heart disease, motor vehicle accidents with untreated sleep apnea. For instance, there was just a recent study on truck drivers. Untreated truck drivers with severe sleep apnea have a 5 times increased risk of an accident compared to if they're treated. So those are the
right, but there are options. There are treatment options, and I'm holding one right here.
Yeah.
Some people may recognize it out there. And believe it or not, these things have gotten smaller over the years, haven't they? How much has technology come in terms of treating sleep apnea?
It's really become much more convenient for patients as far as mobility goes. When these started about 20, 25 years ago, a CPAP machine was about the size of a small college dorm refrigerator.
Right.
Now they're extremely small. They're held in cases such as
And
this.
so you wear this when you sleep, though.
Right, and the masks are better as well. And you wear that as a mask. It blows pressurized air in through that hose into your nose, or your nose and your mouth, and pushes your throat open and keeps it from collapsing.
More comfortable. But it's not like you can just walk into a store and pick up one of those. You say start with a sleep study. And those have changed a little bit too, but you still recommend going in to the clinic to have it done. Is that because the data is more reliable, or what is the benefit there?
That's considered the gold standard for diagnosis. If someone has a high pre-test probability of it. We can often do a home sleep test as well. The problem with the home sleep test, if it's negative, they might have to go on to a full test because it doesn't exclude the diagnosis, but it does confirm the diagnosis. So you can actually save from coming into the sleep lab some by doing home testing as well.
But can you dive into that sleep study a little bit more?
Sure.
What's involved with that? I guess what happens during that sleep study?
Typically come in about 8 o'clock at night, and they have you come in your regular sleeping clothes. You can wear clothes coming in, but you change there. And they hook you up from your head down to your toes, essentially, with a bunch of monitors. We have EEG leads in their head to watch when they're asleep or they're awake, a probe by their nose and their mouth. It looks kind of like you've seen people wearing oxygen. It looks like one of those appliances that measures airflow. You have these little probes by your, just with paste, no needles involved at all, by your eyes to see if you're in rapid eye movement sleep. You have a belt around your chest and your abdomen to see if your chest and abdomen are rising and falling. So if your chest and abdomen are rising and falling, but you're not moving air, then you're not breathing. And then an oxygen monitor, and we have things on your ankles to see if you're kicking your legs all night long for periodic limb movement disorder.
So once you get all of that information back on that patient, then you're able to say, here's what's going on and here's what we can do about it. We've looked at some of these devices, but you have implants available. There are surgical procedures that end up being the best option for some patients, but it really starts with that initial appointment at the CHI Health Lakeside Sleep Center. You can call to make an appointment at 402-758-5530. But as we started this conversation, it wasn't about the patient necessarily understanding there was an issue, but it's about the spouse or the partner that's next to them
Well, that's
that
what I was
says.
gonna say. You said 24% in some populations
Yeah.
are men, so a lot of times it's the women
as
who
soon as he sat down, I
get
said,
them
you
to
know,
go do
my
the sleep
husband,
study.
I think he has sleep apnea, and I'm sure that's where it starts, is somebody else saying, we've got an issue here, let's get it taken care of. Doctor, it's good to have you here.
Nice.
Thanks, Doctor.
Thank
Appreciate it.
you. Thank you. Well, Olympic